Hello, in this video, we are going to talk about nutrition and cancer, and we are going to talk about some of the foods that have been shown to increase the risk of cancer or decrease the risk of cancer, and then also the nutrition recommendations for when you're doing your treatment and then for when you're recovering from your cancer treatment. Now, again, who we are, I always say this in case you're new here, but we're Latinas Contra Cancer. We are a nonprofit organization in San Jose, and we aim to reduce the health disparities around cancer in the Latino community, both by helping patients navigate the healthcare system and then by bringing education and psychosocial support to Latino families. First, we will review what we have talked about, how diet can help us prevent developing cancer that we have talked about in previous presentations, and some other details about foods that have been shown to reduce the risk of developing cancer. So we talked about the connection of obesity and cancer during the first presentations of this series. Remember, we are talking about how obesity, which is we were talking about how obesity, which is an excess of adipose or fat tissue, increases the risk of many diseases like diabetes, high blood pressure, heart disease, stroke, and of course, most cancers, including colon cancer, endometrial cancer, esophagus, breast, liver, pancreas, gallbladder, esophagus, kidney, thyroid, and more. This excess adipose tissue can also make cancer treatment more difficult and therefore decrease the chances of survival once there is a cancer diagnosis. And remember, I also showed and explained these graphs that show that the rates and cases of obesity in the US are higher in the Latino population, both for adults and children, than in the white population. So that means Latinos are at higher risk for being obese and therefore for developing cancer as a result of diet-related factors. Finally, remember, we also mentioned that obesity in children is even more dangerous because it is more likely for a child that is obese to be obese during adulthood and for their obesity to be more severe. We have talked during the last two presentations about what constitutes a healthy meal. We talked about foods that when we eat in excess, they get stored in our body as fat. So we should limit their consumption in order to maintain our body weight. Here I summarize the main points of what we have talked about. To prevent obesity and promote a healthy lifestyle, we have to try to eat balanced meals most days. Remember that moderation is the key. We should avoid added sugars since they are mostly fructose, and excess fructose gets mainly stored in our body as fat. We should minimize saturated fats and eliminate trans fats completely. We should prioritize whole grains and fruits and vegetables because that is where we find most vitamins and minerals that we need. And the trick to make sure that we are eating enough variety of foods and nutrients is that we should try to eat a variety of colors. Finally, the real key to maintaining our weight and preventing excess body fat is to maintain a caloric balance. This means that we need to consume as many calories as we use so that we don't eat, so that what we eat doesn't end up being stored as excess energy, as fat. This can be either, we can have this balance by either consuming less calories, such as by eating smaller portions, or by eating less empty calories if you're not physically active, or that could mean exercising and staying physically active so that you can burn the energy that you do consume. Of course, the best option is to combine these two. We should try to limit our empty calories as well as be active, but theoretically, both of the options I said are good ways to maintain our weight. So now we're going to talk about specific foods that have been directly linked to cancer. You'll notice that the foods will basically be the ones I have already said we should stay away from because they also tend to be linked to other diseases such as heart disease, strokes, diabetes, etc. Now I looked through many academic papers about cancer, and the one food that basically all of the academic papers mentioned that was a risk factor for developing cancer was processed and red meat. So processed meats are basically ham, hot dogs, that kind of stuff. And red meat is basically not poultry, so beef, pork, lamb, etc. It turns out that cooking red meats at high temperatures and with charcoal causes mutagens and carcinogens to be produced. Mutagens and carcinogens are basically molecules that cause harm to our cells and cause them to divide uncontrollably, which is how tumors form. The processed meats like ham and hot dogs are processed with nitrates and salts, and these also cause mutagens and carcinogens to form in the meat. So for these reasons, and also because red meat has quite a bit of saturated fat, red and processed meats are on top of the list of foods that have been linked to an increased risk of cancer. Meats are a source of protein, so to prevent cancer, we should try to rely on white meats like chicken and plant protein for our sources of protein. You can also try to cook red meats at lower temperatures and avoid grilling. Again, remember, everything is good in moderation. So I am not saying that you can never grill meat ever again or that you can never eat red meat ever again. So everything is good in moderation. As I said, I looked through many scientific studies, and these are some of the most common foods that were mentioned for increasing the risk of certain cancers. Alcohol has been shown to increase the risk of multiple common cancers like mouth, throat, esophagus, liver, breast, etc. Saturated fats have been shown to increase the risk of breast cancer and cancers of the digestive system. A high intake of proteins in dairy is also linked to cancer because these proteins in dairy increase the presence of a growth factor, and overactive and uncontrolled growth of our cells is what causes cancer. Now, dairy has its benefits, but again, everything is bad in excess, and that's why a high intake of dairy can be bad. Consumption of added sugars and sweetened beverages like soda increases the risk of GI cancers, particularly pancreatic cancer, as well as the consumption of refined grains. I want to emphasize 2 points about this list. First, these studies that linked these foods to certain cancers do not prove causation. So the studies just saw that there was more cancer cases in those who consumed more saturated fats, for example, than those who didn't. That doesn't mean the saturated fat is the cause of cancer. It doesn't mean that like you eat a saturated fat, you get cancer. That's not the timeline exactly that this is saying. It is simply that if you eat a lot of saturated fats, for some reason, you are more likely to develop cancer. It could be that people who eat a lot of saturated fats also eat a lot of other bad things and are also obese. So then all these factors together can increase the risk of cancer. And second, just because you drink soda, just because you drank a soda yesterday, it doesn't mean you're going to get cancer tomorrow or ever. Our body and cancer are such complex things that we can't just pinpoint one cause. However, consuming all of the things in this list in excess can lead to conditions that make cancer more likely to develop, such as by causing obesity. So again, everything can be good in moderation. You can still eat the foods in this list as long as most of your days you are prioritizing the 6 nutrients we discussed in previous presentations. Now, some foods that have been linked, and these are my links for all the studies that mention these. Now, some foods that have been linked to a decreased risk of cancer are basically the things we encourage you to eat most. So fruits and vegetables and whole grains. Fruits and vegetables have been shown to decrease the risk of most cancers. And here's an example of a study that I thought was really cool and how it shows how important fruits and vegetables can be. One study showed that a high intake of fruits and vegetables in smokers reduced the risk of lung cancer, which is amazing since smoking is such a direct cause of lung cancer. Now, fruits and vegetables are so good for us because this is where we find most vitamins, minerals, and antioxidants. So people are inclined to cut a step and just use vitamin supplements. But there is no evidence that supplements for vitamins and minerals reduce the risk of cancer. In fact, there is evidence that too many vitamins and minerals are bad for us and cause problems in our body. And it's really easy to consume more than the recommended amounts of certain vitamins and minerals with supplements because they are really concentrated forms of vitamins and minerals. So it's just better to get your nutrients directly from fruits and vegetables. Having sufficient calcium has also been shown to decrease the risk of GI cancers. But again, too much calcium has been shown to increase the risk of GI cancers. So even good things can end up being bad in excess. And finally, this is not a food, but exercise also helps you reduce your risk of cancer and just helps you have a better quality of life. Now, we're going to move on and talk about the nutrition recommendations once you are diagnosed with cancer and you are undergoing treatment, and also once your treatment is over and you are recovering. The symptoms you experience during your treatment will depend on the kind of cancer you have, the kind of treatment you get, and just it's going to be different for everybody because we all have different bodies. Some common symptoms are anorexia, feeling full really fast, changes in taste and smell, different bathroom habits, loss of appetite, nausea, vomiting, weight change, loss of muscle mass, pain, and fatigue. Unfortunately, these symptoms lead to changes in your nutrition and can lead to malnutrition, which means not getting enough nutrients. Weight loss and poor nutritional status have been documented in more than 50% of patients at the time of their cancer diagnosis. So it is fair to expect a change in your relationship with food during your cancer journey. However, that change will be different for everyone. And like I said, it also depends on the kind of cancer you have. So for example, what is most common in breast cancer cases is a gain of weight rather than a loss of weight. Here are some additional facts. 40% of cancer patients report a decreased appetite since beginning their treatment, as well as increased sensitivities to certain smells. Patients with GI cancers also experience a higher burden on the nutrition-related side effects since the cancer affects the digestive tract. So all these things will change the way you feel about food. Some foods will seem more and some will seem less appealing than before, and sometimes food won't feel appealing at all. So during your treatment, your body often needs extra calories and protein to help you maintain your weight and to heal as quickly as possible. So definitely continue to follow the normal recommendations for a healthy meal and stay away from those top foods that can increase the risk of cancer, like red meat. Try different foods that you might not usually try, since your taste preferences might be different. Also target the foods you eat to your symptoms. So for example, if one of the symptoms of your cancer treatment is a really sore throat, then avoid dry foods and try softer and more liquid foods. You can also find at the link cited down here at the bottom some more specific food suggestions and snack ideas for when you are going through cancer treatment. Make sure you talk to your medical providers to see if they can refer you to a dietitian or to a personal trainer, and to see if your medical insurance covers it, so that you can get help finding a diet plan that will fit you and your symptoms, because it will be different for everybody. Do not be afraid to ask your doctor for help with the nutrition, and to find a individualized plan. Do not be afraid. You lose nothing by asking to see if your insurance covers it. You never know if it will. Finally, studies show that exercising is perfectly safe during cancer treatment. It can help with with many psychological aspects like anxiety, depression, fatigue, self-esteem, happiness. It can increase your quality of life and improve your cardiovascular fitness, your muscle strength, and your body composition. It's perfectly safe. It definitely will not be easy, and you might not feel like you have enough energy. So listen to your body, but do try to get some exercise. Now we're going to talk about the recommendations for after you have finished your treatment and begin recovering. Cancer survivors are at a greater risk for developing other diseases, including secondary cancers. So developing cancer again such as developing cancer again due to their diminished defenses. Both the disease of cancer and then also the treatment for cancer can reduce your immune system and stop it from working perfectly. So then your cancer survivors are at greater risk for developing different cancers and other diseases. So for these reasons, living a healthy lifestyle by eating right, exercising, and managing weight is particularly important for cancer survivors, not just to prevent new diseases, but also to maximize your quality of life. Studies have shown that simply by improving diets, studies have shown that simply improving diets has shown improved physical functioning, lower levels of depression, and a reduction of new cancer events in cancer survivors. So that's just by improving diet. So definitely try to consider prioritizing your diet if you're a cancer survivor. The nutrition recommendations are basically the same as for non-cancer survivors. Continue to do your best to follow the normal nutrition recommendations. Feel free to rewatch the recorded videos for our previous presentations in this nutrition series, where we lay out all of the specifics about eating a healthy meal. Exercising is also completely safe, and like we've said, it has been shown by scientific studies to increase the quality of life of cancer survivors. Again, do not be afraid to ask your medical team, whether it is during your treatment or after your treatment, to try to see what resources there are for you to get an individualized food plan and exercise plan that is directed towards you and your symptoms. That is all we have to say about for this presentation. Thank you so much for watching. Please share this information with any of your family members, friends that are going through a cancer treatment or recovering. This information is really important. Nutrition is really important. Share these series with your family and talk about it. We definitely want this information to spread as far and wide as possible.